There is a lack of knowledge out there with healthcare professionals and with women in general.
When your doctor is being a bit dismissive, I'm going to let you in on a little secret.
Let's just start with menopause and weight loss.
These are all the factors that really lead to the weight gain in menopause and stand in the way of weight loss.
Helping your doctor help you on your weight loss journey? What are some of the questions you can ask, the conversations that you can have? How often do you check in? Is there a difference between men and women? Joining me today to have that conversation and so much more is Dr. Jennifer Zelovitzky. She is a board certified family physician. She's a certified menopause practitioner. I know so many people right now are sitting up in their seats and listening because they're itching to have that conversation. She's also the director of women's health and vitality at MedCan Toronto. So you've all gone to the doctor. Doctor says you need to eat better. You need to lose weight. What is your suggestion for people? Where's the starting point? Should they be checking in with you as their doctor? Any advice there?
Yeah, so I do have a background in family medicine, and I know that family doctors typically are not as well educated in this area of care as most patients wish they were. So as much as I would like to say that your family doctor is the best partner for you in your weight loss journey, sometimes that's not the case, although it can be very useful to have your doctor there for regular check-ins and accountability. Now, if you're in a medically managed weight loss situation, so you're using something like Contrave or a GLP-1 agonist, then you will be checking in with your doctor and they might have better advice for you in terms of your goals for tracking. They're watching your cholesterol levels. They're doing all of those check-ins. But if you're doing it, through a lifestyle approach, I would say the best way to engage your doctor is for regular check-ins, more for accountability, for somebody to be measuring your blood pressure, checking your blood work, making sure that from a metabolic perspective, things are going in the right direction. Yeah. So I think that using your family doctor as just the center hub of a network of providers who can help you stay accountable and stay on that successful journey to weight loss.
What is your advice for people going to see their doctor when it comes to an overweight person or someone's carrying extra weight where their doctor is just like, you just got to go, you got to lose weight. That's going to basically fix everything. And a lot of times people feel if they failed at dieting in the past that they're not worthy of going to see their doctor.
Right.
They want to wait until they're healthy to see their doctor. So any advice there in terms of like, if you're hesitant to have a conversation with your doctor or your healthcare provider, how to do that and the importance of doing it?
I'm going to let you in on a little secret. When your doctor is being a bit dismissive, you've probably stumbled into an area of care where they have a lack of education and a lack of confidence in managing it. So if we kind of flip it on its head, I know I can speak for sure to these two particular topics, menopause and weight loss. We do not get enough education, and the factors that affect obesity especially have changed, and our understanding of weight loss has changed dramatically in the past, 10, 20, 30 years. It's not as simple anymore as calories in, calories out. And it's definitely not a one size fits all approach. So even if your physician has an understanding of what might work in general, they may not have as good an understanding of what may impact weight loss in a woman going through the menopause transition. Yeah. And so sometimes the dismissive aspect is really coming from their own discomfort because they really are afraid to say, I don't know. It's a really vulnerable thing for a physician to say to a patient. But unfortunately, there are areas of care that are sort of black holes in the education system. And my hope is that will change in the future. But for now, I think you have to meet your doctor where they're at and ask them to refer you on to someone that can better support you. There are lots of weight loss physicians out there who do have specific training in this area of care, and they are available by referral. And don't be afraid to just directly ask your doctor for a referral.
this is why being an advocate for yourself and doing the things that you can do, and why the living method is so great, because beyond weight loss, it is helping you to make your body healthier, but most importantly, helping you to get in tune to your body's needs, so that when you are experiencing things, you can better articulate what you think is going on and how you're feeling. Is there a difference between men and women's health care? In a sense, would a man approach their conversations with their doctor differently than a woman?
I think that the factors affecting women are at a different age. Maybe that's really where the difference comes in.
Okay.
Men are basically always at a higher risk for cardiovascular disease, so heart attack, stroke, than women. One of the main reasons is that women have the advantage of estrogen until menopause, and estrogen helps keep blood vessels nice and calm and relaxed, and helps keep our blood pressure a little lower, helps prevent cholesterol buildup. But then when women go through the menopause transition, they start to catch up to men in terms of their cardiovascular risk. So bearing that in mind, the factors that will affect a woman's health start to accelerate after the menopause transition. Whereas for men, they always, from let's say 40 on, have a higher risk of developing disease than women.
But it occurred to me that this big conversation is happening, and maybe a little insight into, why, especially when it comes to weight loss, that menopause conversation is really important, because men and women have hormones. Obviously there's cortisol and insulin, your hunger hormones and all those other hormones. But why do these sex hormones, the estrogen, progesterone, testosterone, why is that such a big conversation with women?
As more and more physicians like myself have become trained in this area and have had access to newer, better evidence and information, we are recognizing that we can dramatically improve not just the quality of life, but the health span of our female patients by providing them with both lifestyle guidance and, where appropriate, hormone therapy to manage their menopause symptoms. But there's also been a recognition that the factors influencing weight gain and weight loss are quite different for women at midlife. It's partly hormonal, and it's partly lifestyle, and it's partly the downstream effects of the hormone deprivation. The truth is, with respect to andropause, this is not as prevalent as, people would think. It's
Yeah.
not the same thing. I used to get this question like, do men have menopause? No. The truth is that for both men and women, our testosterone levels do not decline at midlife, typically, or as dramatically as estrogen does for women. And we do at MedCan, we offer men the option to have their testosterone levels checked. And the vast majority of men, do have a normal testosterone level. I think there's
Okay.
an assumption that if you're having erectile dysfunction or you're really exhausted all the time, that's because your testosterone's low. And more often than not, it's other factors. You might have cardiovascular disease, that like diabetes or elevated cholesterol, or some other something else affecting your small blood vessels, including those leading to your penis. So stress, relationship difficulties, extreme exhaustion, those are all things that can affect a man's ability to have an erection, to have a good sex life, to feel energized. So I would say it's worthwhile to explore with your doctor whether your testosterone levels are in the normal range. But we have to look outside of just hormones when we're looking for solutions. And the same goes for women to an extent. Estrogen does lead the charge in menopause in terms of the things that will cause us to gain that midsection weight gain, the things that cause us to be exhausted and to be foggy and to be irritable. However, it's not the only player in the game, and you can't just replace estrogen and magically lose weight and magically be sleeping well and all of those other things that we wish it would do, but it's not a magic bullet.
Let's get into the menopause conversation. Let's get into it. There's a lot that you can do to address the symptoms that you have and especially help you with weight loss. As you know, the Living Method has always helped.
There's several things that we know drive weight gain in the menopause transition.
Okay.
First and foremost is estrogen decline, estrogen deprivation. Because what that does is, as that's subtly starting in our mid 30s to late 30s, in the background, we're starting to lose our lean muscle mass and it's getting converted to visceral fat. And it's imperceptible at first. This is that fatty tissue that's around your midsection. Part of the reason this is happening is that visceral fat can produce estrogen at low levels. And visceral fat becomes the main source of estrogen after the ovaries have packed up shop. So that's one thing. And I wish it was as simple as saying, great, let's give some estrogen and we'll turn all that off. But what happens is that visceral fat is highly metabolically active and it starts to create other hormonal changes in the body that perpetuate the weight gain, such as insulin resistance, elevated cholesterol, because visceral fat molecules carry more cholesterol, inflammation. So you're getting more aches and pains. So you're not moving as much, you're tired. And then there are the other factors beyond hormonal. There's the sleep deprivation. We have really good data to support the fact that women need about 7 hours of sleep, of which 20% is deep sleep, to promote a healthy weight maintenance and to promote weight loss. And then there's the microbiome. So the healthy bacteria in our digestive tract, which allows us to properly absorb nutrients from our food, but also it has an important role to play in our immune function and in our mood. It declines not only in number, but in the variety of healthy bacteria in our microbiome at midlife. And so using a probiotic can be a very, very helpful tool for this specific reason. You want to be maximizing the nutrient absorption from your diet to help you get those fatty acids, to help you get that protein. And so those are muscle mass loss, estrogen deprivation, sleep deprivation, sedentary lifestyle. These are all factors, and inflammation. These are all the factors that really lead to the weight gain in menopause and stand in the way of weight loss.
If people are having a hard time getting their weight to move, it can be due to inflammation, food sensitivities, hormones, obviously, and then gut issues like your microbiome. And that's where we introduce the probiotic and prebiotic. And it's really how it all works together. It occurs to me that there is a lack of knowledge out there with healthcare professionals and with women in general. And we should have a more robust, I know we're going to conversation on menopause. People are asking, how long is menopause? So there is perimenopause that can start as early as 35, sometimes younger in some cases. There is menopause, which is just one day. This is where the conversation gets complicated because menopause refers to one day, after you have a year of not getting your menstrual cycle, the one day, and then you go into postmenopause, which is the time after. Menopause is sort of the catch-all term that we use to describe all of the
and I often say menopause transition because it is a transitional time and it's different for everyone. The average age is about 51 that you actually have your final periods, but the menopause transition or perimenopause is really what we're talking about when we're talking about managing the symptoms and when things start. Because you're right, it can start 10 years before that final period.
A lot of people think that HRT is going to be their solution to weight loss. And if I just take HRT, and I think very similar to the GLP-1 medications, weight loss medications, it's not an easy it's not an easy fix, and it's not just taking the drug or not just taking the HRT that is necessarily going to be the magic pill for weight loss. But if you feel like you're struggling and wondering what more can you do, and you feel like your hormones are impacting you, and you feel like you're not getting great sleep, and you're stressed and you're not moving your body, it's all
Yeah.
how it all works together. Dr. Jennifer Zelovitzky, I'm so grateful that you have joined our team as one of our amazing guest experts, and that you will be back and continue the conversation for us. And I'm even more grateful that you've taken the time to share your knowledge and expertise.
Thank you, Gina. Thank you, everybody. And have a great day.
Thanks, everyone.